Dale Wondesford. I'm with Medicare Supplement Headquarters, and I'm bringing you a Medicare 101 information series, and that's obviously on my website. And want to share with you my background. I'm an independent insurance agent. Been doing this for 12 years now, and really love what I do. It's been a passion of mine for many years now, and what my focus is entirely on Medicare and Medicare products, and making sure you're getting the most out of your Medicare, whether it be Advantage or Medicare supplement plans or Part D. And there's a lot of information, and things can get very confusing very quickly. And if you're new to Medicare and you're turning 65 for the first time, and you're inundated with phone calls and material in the mail, and usually it's coming from all sorts of different insurance companies. And what I do is I help a client explain all the parts of Medicare, the A, B, C's, and D's, and just clarify everything, answer all your questions, and really customize a plan that's going to fit your needs, not just now, but in the future. So the Medicare started in 1965. And this was a program passed under President Lyndon Johnson. And this is a federal program for people retiring. People are turning 65 is the bulk of Medicare. There's over 62 million people currently on Medicare. You also can obtain Medicare due to a disability. So there's no age requirement to be on Medicare, but if you have been disabled for 2 years, you probably can qualify for Medicare as well. And people with other conditions, medical conditions, also can qualify for Medicare. Now, once you've worked 10 years or put in 40 non-consecutive quarters, it allows you to get Medicare Part A at no charge. And Medicare Part A is going to be your hospital coverage, also going to cover skilled nursing facility and hospice care. And it's really just the facility side of things that's involved in Part A of Medicare. And there is no premium for it if you've put in your quarters or years of service, and it's already been deducted from your paycheck if you look at a W-2 paycheck, you'll see a line item for Medicare on there. And so there's been a lot of misconceptions. A lot of people think it's free. So technically, if you've put in your quarters, Medicare Part A is no charge. And then we talk about Part B of Medicare, which is going to be your doctors, inpatient, outpatient surgery. It's going to include the durable medical equipment, ambulatory services, inpatient surgery, outpatient surgery, the ambulance, I said durables already, blood transfers, blood storage, things of that nature all fall under Part B of Medicare. So basically, all the services that you would receive under Medicare fall under Part B. Now, Part B, going into 2021, the standard Part B premium is $148.50, $148.50 per month. Now, if you are currently on Social Security, that amount will be deducted from your benefit check on a monthly basis. If you're not on Social Security, this amount will be billed to you on a quarterly basis, and that's why I encourage all my clients to set up a mymedicare.gov account, which will show all the invoices for the statements, and they can actually pay the premium right there on the website with full transparency. Now, Part B of Medicare, the premium does go up over time. Last year it was $144.60, 2021 it's $148.50. Now, that's the standard premium. Now, if your income falls and above certain thresholds, then you might have to pay a higher premium. And so we can discuss that as well. I'll also have a video about IRMAA, which is income related monthly adjustment amount. And this is an amount that may surprise you if you fall in a certain income category. So one of the things I do discuss with the client is the income levels, or if they're under a certain amount, just to see if that needs to be part of the conversation. And so this is a brief overview of Medicare. Medicare has, like I said, over 62 million people in the Medicare across the United States and our territories. And there are many different parts of different plan options for people. And so, I'm going to do a series of videos related to different plan types. That's going to be your Medicare Advantage variety, Medigap or Medicare Supplement variety, and also Part D, which is prescription drug coverage. So thanks for taking the time to listen today. If you can reference back to my website, you can also give me a call directly.
Thank you for watching this video. There's more to learn from our library of resources on the website MedicarePlansForUs.com. The link is in the description box below. If you would like to learn how you can get your questions answered by our Medicare specialist at no cost to you, click the link in the description box to get started today. Visit the description box for more tips on cutting your out-of-pocket Medicare costs from the Medigap Supplement headquarters.